Okay guys, so we're gonna demonstrate how to set up a push-pull system to give fluids to our patients in case the provider just does not want to have it on the IV line or just like the pump itself. So these are all of the supplies that you're going to need. You're going to obviously need your saline. Depending on the size of the patient, you can use the 60 ml syringe, or if it's a smaller child, maybe the 20 ml. You're going to need your 3-way stopcock, obviously your IV supplies, and then blood tubing. We use blood tubing for this just because it has a wider gauge, so it's easier to push and pull these fluids through. So these are all their supplies you're going to need, and obviously your IV pump as well, just to hang the fluids. We're not using the IV pump, we're just hanging them up on the hook. So these are all the supplies that you are going to need.
All right, guys, so our patient is here, line is in, and we have our fluids selected that the doctor's ordered. So we're gonna go ahead and start by getting the line primed. Go ahead and get this opened. And again, just a reminder, blood tubing is being used because it has a wider gauge than our regular tubing, so it makes it quicker and easier to be able to draw this, which is what we want when we're doing a push-pull, because that makes it faster. All right, so we'll go ahead and prime these fluids. Make sure you've got your clamp rolled so you don't make a mess. That primed through. All right. Once you're primed all the way through, you would go ahead and get your stopcock out. This is gonna go between your end of your IV line and your tubing. So get these done here. And then next, you would have your syringe hooked up to the third connection. So for this patient, we'll go ahead and choose the 20 ml syringe again, just dependent on the patient and what is gonna make the math easiest for you. So once you are set up that way, you are ready to go.
All right guys, so just as Sarah's shown you, we have now our 3-way stopcock for our push-pull set up. The biggest thing now, this part is actually super simple. This is our off button, so this is wherever your fluids are off to or wherever you don't want to push to pull to. So right now off is to our syringe, so we can't do anything. So we are going to turn this off to our patient. So now we have free access up to our fluids. So this is where you can pull back. You're going to start getting your fluids. Let me see if this is unclamped. Helps if it's this is unclamped. So double check if you meet too much resistance, then work your way up your line, figure out the problem. Pull your syringe back. Now you have your 20 mLs. Now you want to switch this off to your fluids. So now you have access to your patient. So now you are ready to administer your fluids. You may meet some resistance. It depends on the IV gauge. It just depends. And then make sure with this, you're just assessing your IV line for any infiltration, anything that shows that maybe the line is blown or that it's just not going through. And it's same thing, just repeat. Off to your patient, pull your fluids back, off to your fluids, push your fluids through. Simple as that. And that is our push-pull system.